Thank you for tuning in to Great Day Colorado's best podcast show. If you are listening to our short clips on TikTok, Instagram, or other social media sites, please visit greatdaycolorado.com to listen and download the full version. Thank you for being a fan and sharing the love. Now on to the show. Welcome to Great Day Colorado's Mile High Matters. I'm DJ Mikey D. For this episode, we will discuss why fentanyl concentrations in Denver have risen, what local data tells us, and how Mayor Mike Johnston is responding to the crisis. Have you driven up to intersections in the Denver metro and observed a person almost in a zombie state bent completely forward that would make a yoga fanatic jealous? If so, it is likely they are more than just mile high. They are on fentanyl or a combination of various other drugs. Fentanyl is a synthetic opioid many times more potent than heroin or morphine. Over the past several years, Denver, like many U.S. cities, has seen a sharp increase in fentanyl-related overdoses and deaths. In Colorado overall, the state health department reported a dramatic increase in fentanyl-involved deaths over the last 5 years, and Denver County's overdose numbers have reflected that trend. This episode breaks down contributing factors and local responses. Here are the key local figures listeners should know. Denver's medical examiner and local public health reporting show fentanyl has been a leading driver of overdose deaths in recent years, often surpassing heroin and prescription opioids in involvement. In Denver County, emergency departments and EMS have reported increased fentanyl-related runs and overdoses year over year. Federal and state surveillance also show a nationwide spike in fentanyl presence in both pressed pills and powder sold as other drugs. Law enforcement and public health agencies have noted that a large share of recent overdose deaths involve fentanyl combined with stimulants like methamphetamine or cocaine. Why Denver is seeing higher fentanyl concentration? Several interacting reasons help explain why fentanyl has become more concentrated in Denver's illicit drug supply. For example, supply and economics. Fentanyl is cheap to produce and extremely potent in small amounts, which lowers transport risk and raises profit margins. Traffickers across regions, including those supplying Colorado, shifted toward fentanyl because it's easier to traffic and more profitable. Other factors: distribution networks and geography. Denver is a regional hub for transportation and commerce in the Mountain West. Major highways and rail links make it a distribution node, which can increase availability of illicit drugs passing through or sold locally. Another example: polysubstance use trends. Dealers increasingly press fentanyl into counterfeit pills or mix it with other drugs, heroin, meth, cocaine, to increase potency or mimic prescription opioids. Users may not know a product contains fentanyl, elevating overdose risk. Changes in demand and tolerance. People with opioid use disorder who lost access to prescription opioids may shift to illicit supplies, where fentanyl has largely supplanted heroin. Those with reduced opioid tolerance are at higher overdose risk when fentanyl is present. Lastly, testing and detection improvements. Greater use of toxicology, testing, and public health surveillance has increased detection of fentanyl, making concentrations appear higher, though the underlying spread is also real. So, what is the health and community impact? The human toll shows up in emergency calls, hospitalizations, and deaths, plus ripple effects across families and services. Denver's first responders report more naloxone administrations, and harm reduction providers have scaled up testing strip distribution and outreach. Communities bear both heartbreaking loss and strain on public resources. So, what is Mayor Mike Johnston's response? Mayor Mike Johnston and Denver city agencies have taken several steps to address the crisis. Key components of the local response include expanding harm reduction. What is that, you ask? The city has supported distribution of naloxone and fentanyl test strips, backed syringe services, and coordinated with nonprofit harm reduction organizations to reach people who use drugs. They also have increased treatment access and recovery services. Initiatives aim to increase access to medication for opioid use disorder, like buprenorphine and methadone, through city clinics, partnerships with hospitals, and mobile outreach. The mayor's office has emphasized expanding low-barrier treatment and rapid referrals from emergency departments and shelters. The mayor's office has also increased public education and warnings. Denver Public Health and the mayor's office issue alerts about counterfeit pills and dangerous batches, and run public awareness campaigns to encourage carrying naloxone and using testing strips. Authorities have pursued investigations targeting major suppliers and organized distribution networks. The city describes a balanced approach, targets supply chains, but prioritizes public health measures to reduce harm. Mayor Johnston has pushed for federal and state grant funding and coordinated between public health, EMS, hospitals, behavioral health providers, and community organizations to align response efforts. Progress includes wider naloxone availability, more community harm reduction services, and increased treatment capacity. Challenges remain. Supply remains volatile. Stigma and access barriers still stop many from seeking treatment, and resource limitations constrain rapid scaling. Experts say a multi-pronged approach, prevention, harm reduction, treatment, recovery supports, and targeted enforcement, is essential. If you or someone you know is struggling with substance use in Denver, local resources include Denver Health community clinics offering medications for opioid use disorder, harm reduction groups that distribute naloxone and test strips, and the Colorado Crisis Services line at 1-844-493-TALK. For updated local numbers and program details, check Denver Public Health and the Colorado Department of Public Health and Environment websites. Thanks for listening to Great Day Colorado's Mile High Matters. I'm DJ Mikey D. Stay locked in for our next episode about how local schools are responding to student substance use after these brief messages. Be sure to visit greatdaycolorado.com to answer the latest poll on questions that concern Colorado. Stay safe. Good morning, Colorado. Welcome to Great Day Colorado, supporting local businesses. I'm your host, DJ Mikey D, coming at you with some fantastic local news that'll brighten your day. Today, we're giving a massive shout out to the incredibly talented Kiana Rose out of Colorado Springs. Now, if that name sounds familiar, it's because Kiana has been making waves over at Paul Mitchell Cosmetology School in Colorado Springs, honing her skills and perfecting her craft. And here's the exciting part. Kiana is now stepping out on her own, offering her services to the community while she builds her portfolio and gains that valuable real-world experience. This is exactly the kind of local talent we love to champion here on Great Day Colorado. You know, supporting emerging professionals like Kiana isn't just about getting great service. It's about investing in our community's future. When we support local dreams, we're building a stronger Colorado together. So here's my challenge to you, Colorado. Let's rally behind Kiana and help her achieve those goals and dreams. Whether you're looking for a fresh new look, some expert skincare, or just want to treat yourself to some quality self-care, now is the perfect time to book an appointment. Imagine walking out with glowing skin, feeling refreshed and revitalized, all while knowing you're supporting a local Colorado Springs entrepreneur chasing her passion. Ready to book? Here's what you need to do. Call 719-636-1426 to schedule your appointment today. That's 719-636-1426. Treat yourself to that well-deserved self-care and help a local talent shine. Let's make it a great day for Kiana Rose and for Colorado. Until next time, this is DJ Mikey D, reminding you to shop local, support local, and build our community together. Welcome to Great Day Colorado's Mile High Matters, the podcast that explores the people, policies, and places shaping life in Denver and beyond. I'm DJ Mikey D, coming to you with the latest on what's happening in our schools and communities. For this episode, we're tackling a tough but crucial topic, student increase in substance use here in the Denver metro. Let's start with the big picture. We've seen some significant shifts since Colorado legalized recreational marijuana back in 2012. Now, while purchase remains restricted to adults 21 and over, we did see increases in adolescent access and accidental exposures in those early years after legalization. And it's not just cannabis we're talking about. National and state trends show rising use of vaping products among adolescents, plus persistent alcohol use that continues to be a concern across our high schools and middle schools. So what are Denver area schools doing about this? Well, they're taking a multi-pronged approach. Districts are reinforcing and updating student conduct codes to explicitly address new products and behaviors. They're coordinating with local law enforcement for incidents that indicate criminal behavior. But here's the important shift. They're striving to balance disciplinary action with educational and health-focused responses. Many schools are now using evidence-based curricula to educate students about substance use risks and decision-making skills. After that youth vaping surge we saw a few years back, anti-vaping campaigns and targeted education really ramped up to inform students and families about health risks and legal consequences. Here's where things get really interesting. and promising. Schools are increasingly adopting screening and brief intervention approaches. Instead of just punishing students, they're identifying those at risk and connecting them with services. Many Denver area schools have expanded access to on-site mental health clinicians and school-based health centers that can provide brief interventions or referrals to community treatment. Family involvement is another key piece of this puzzle. Schools are working with parents through education nights and regular communications, providing information on how to recognize substance use and secure products at home. Partnerships with community organizations are creating referral pathways for assessment and treatment, while supplying prevention resources. Some schools are even emphasizing harm reduction messaging, encouraging students to seek help for peers in overdose situations and training staff in naloxone administration. They're also educating students about the specific risks of cannabis-infused edibles and those high THC vaping cartridges that have become so prevalent. This represents a real philosophical shift in how we approach student discipline. Instead of exclusionary practices like suspension, many Denver schools are implementing restorative justice and supportive disciplinary alternatives that focus on accountability and connection to services. Data collection is also playing a bigger role. Districts are using incident reports and anonymous student surveys to track trends and tailor their responses to emerging products and risk patterns. It's about being proactive rather than reactive. Now, let's be real about the challenges that remain. There are still barriers to timely youth-appropriate treatment. The influence of legal adult cannabis markets continues to be a factor, and the rapid evolution of new products, especially in the vaping space, makes it difficult for prevention efforts to keep pace. Resource constraints are another reality, particularly in schools with limited counseling staff. Progress really depends on strengthening community treatment capacity, keeping prevention messaging current, and ensuring equitable access to support services for all students, regardless of which school they attend or what neighborhood they live in. Looking ahead, the work continues. Schools are adapting to changing patterns, evolving laws, and new products that seem to emerge constantly. The focus is on creating environments where students can make healthy choices and get support when they need it. What's clear is that the old approach of just punishing students wasn't working. The shift toward education, intervention, and support represents a more compassionate and effective way to address student substance use while keeping our schools safe and focused on learning. If you're a parent or educator worried about student substance use, check the show notes for local resources, hotlines, and links to Denver Public Schools health pages and state public health guidance. Thanks for listening to Great Day Colorado's Mile High Matters. I'm DJ Mikey D. If this episode was helpful, subscribe and share, and join us on our next episode as we look at affordable housing initiatives across the region. Thank you for being a Great Day Colorado fan. Be sure to check out our latest poll about Colorado. Also, make sure you sign up for our newsletter to receive the latest podcast updates and contest announcements to win some cool giveaways.